Hello, I am Dr. Baltazar Sanabria. I am a dermatologist in Brazil and have been working with hair transplants for 9 years. I am also a medical researcher. I work with research using oral minoxidil and also sublingual minoxidil. Today, I am going to share with you my personal experience with long hair FU hair transplants. This in the last 2 years. I have dedicated myself to this beautiful hair transplant technique, consistently offering patients a different and innovative method, right? From the conventional one, which would be the scrape technique. Today, I am going to talk about 4 cases that I recently operated on using the long hair FUE technique. The first case is a woman. This woman's complaint was thin eyebrows with few hairs, and she was bothered by them also with the size of her forehead. So we worked on the eyebrows and the forehead area there, and including the entrances. This is at the time of the surgery, just before entering the operating room, and here we get the result immediately after surgery. In this case, we worked with 3,100 follicles, of which 2,500 were implanted in the hairline, and we filled the eyebrows with 600 follicles, okay? We increased the density with 300 follicles in each eyebrow and the hairline. We placed approximately 2,500 follicles in a single session. It was a long procedure because we first had to do the eyebrows, and after we finished the eyebrows, we went on to do the hairline. It was a surgery of approximately 10 hours and 30 minutes, okay? So here is a female case that we did recently. Folks, I am here with another case, a 40-year-old male patient with grade 3 baldness. We opted to do a hairline reconstruction because he had a loss there, a retraction of the temporal recess, and also a loss of the entire hairline and scalp volume. The day after the surgery, he comes with this result. An excellent coverage. Here, 4,900 follicles were removed using the long hair method. We redid the entire hairline and also reconstructed the temporal recesses. Okay, great coverage, great density. So we observed the donor area completely preserved with no signs of having done a very smooth extraction, resulting in a very well preserved donor area. It was a very good case with thick hair, which made it very easy to extract the long strands. Showing you here another case, a patient who underwent the FUE long hair technique. So he had baldness at Norwood scale grade 4, and we did a reconstruction. We reduced the size of the receding hairline, improved the volume of the quiff, and also improved the mid-scalp region. In the immediate post-operative period, after 1 week, this patient came for an evaluation with very interesting coverage. The patient is very satisfied. We are showing the implanted strands, right? The reconstructed temporal recess. So another case using the FU long hair technique. Here we use 3,900 follicular units with long strands. This is another patient, a very young patient, 25 years old. He had a very big complaint, a very large forehead, a very large hairline, and he wanted to have the surgery. We treated him first, even with the treatment stage. He really wanted a reduction of the hairline, and we did his surgery. So this one here is before the surgery. We reduced the hairline, also reconstructed a bit of the temporal recess, and this here is the immediate result after the surgery. In this case, we did 3,200 follicles in the 2 hairlines and also in the forelock area. A very interesting case too. The patient was very happy because the patient already leaves with a perspective of how the result of this surgery will be. I passed on 4 cases to you. I am available to talk about how to optimize and how to conduct large hair transplant sessions using the full long hair technique. Thanks for your attention.